All right, future nurses, welcome. Today, we are going to master the art of seeing the invisible. We're talking about decoding those super subtle clues that newborns give us when they're in trouble. This is all about taking what you've learned in the books and turning it into real, life-saving action. So, let's just dive right in. Okay, picture this. You walk into the nursery, and this is what you see. So what's your next move? For a late preterm infant, and remember, they already have fewer reserves to begin with, these aren't just random observations. No, these are critical data points. What you do in the next 5 minutes, it could literally change this baby's entire clinical course. And this is where you come in. You are the first line of defense. Your ability to spot the difference between, a normal newborn adjustment and a potentially life-threatening complication, well, that's what makes you a great nurse. This quote isn't just some nice recommendation, it's the absolute core of your responsibility at the bedside. So, how do we put all this into practice? Let's start with one of the most common challenges you're going to face, a baby who's struggling to breathe. We're talking about transient tachypnea of the newborn, or TTN for short. I want you to think of it like trying to breathe through a wet sponge. That's kind of what's happening. The baby's lungs are still a bit waterlogged with all that fetal fluid, and they just need our help to clear it out. Now, the key word here is transient. It's temporary, but our support during this window is absolutely critical. So here's your roadmap for what to look for. Think about it. A baby born by C-section didn't get that final big squeeze through the birth canal that helps wring out all that lung fluid. So right away, they're at a higher risk. You're going to be on high alert, listening for that little grunt, which is the baby's own way of trying to keep their air sacs open and watching for that chest pulling in with every single breath. So, what do? Well, our goal is pretty simple. Support the baby's breathing. We might give them a little extra oxygen to ease their workload, and we'll probably use a feeding tube to conserve their energy. Why? Because right now, every single calorie they have is going towards the work of breathing. With our help, they should be breathing normally within a day or two. Okay, we've covered breathing. Now let's switch gears to another super common newborn issue, jaundice. You know, that yellow tint might look kinda harmless, but we have to know when it's a sign of a much deeper problem.
Listen to this, because it's so important. When it comes to jaundice, timing is everything. If you see that yellow tint on day 1, it's a medical emergency. You have to act fast to prevent something called kernicterus, which is irreversible brain damage. It happens when bilirubin levels get so high they actually cross the blood-brain barrier. It's just something we have to prevent.
This table here breaks it all down for you. The key differences you just have to know. So on the left, you've got the normal, totally harmless kind of jaundice. It appears after 24 hours, just as the baby's liver's getting up to speed. But on the right, that's the one that shows up on day 1. It signals a serious underlying problem, like a blood incompatibility, and that requires immediate intervention. Now, phototherapy can look really scary to parents. Their baby's under these strange blue lights. So it's our job to reassure them, to explain that this space-age-looking treatment is actually super safe and effective. It just helps break down that bilirubin. We'll protect the baby's eyes, of course, keep them warm and hydrated, monitor them closely, and make sure we explain that those frequent green stools, that actually means the treatment is working. Okay. Next up, let's talk about a baby who often looks really healthy, big and robust even, but is actually at high risk for some pretty serious complications. This is the infant of a diabetic mother, or IDM. The IDM is a total paradox. They look big and healthy because their mom's high blood sugar caused them to produce a ton of extra insulin, and that insulin acted like a growth hormone. But the second that umbilical cord is cut, their constant sugar supply is just gone. Poof! But their pancreas, it's still pumping out all that insulin. This puts them at an immediate risk for a sudden, dangerous crash in their blood sugar. So your number one priority, without a doubt, is to check their blood sugar. A quick heel stick right after birth will tell you if they're hypoglycemic. And you're going to be looking for those really subtle signs, things like jitteriness, a weak cry, or even just a floppy ragdoll feel when you pick them up. All of those are clues that their brain isn't getting the fuel it desperately needs. So far, we've talked about problems that come from the baby's own physiology, right? Now let's look at 2 conditions caused by factors from the outside world, infection and prenatal drug withdrawal. Sepsis is like a silent killer in newborns. Seriously, the signs are notoriously subtle. It might be a low temperature, not a high one. It could just be that the baby isn't feeding with their usual energy. You really have to trust your gut on this one. If a baby just seems off, if they're just not acting right, it is your job to sound the alarm. Think about it. In a world with all this high-tech medical equipment, these multi-million-dollar NICUs, complex medications, what is the one simple thing that you can do to save a newborn's life?
That's it. It's not some new wonder drug or a fancy machine. The single most effective, evidence-based way to prevent devastating infections in these tiny, vulnerable infants is to wash your hands. It is that simple and it is that profound.
Your hands are your most powerful weapon in the fight against infection, so use them wisely. Every single time you approach a newborn, this right here is step one, period.
Now, I want you to imagine being born into a world that's just too loud, too bright, and completely overwhelming. I mean, can you even picture it? That's what it can feel like for a baby with neonatal abstinence syndrome. They're going through withdrawal, and they need our help to feel safe and calm.
So here's how you create a healing environment for them. And believe it or not, our main intervention isn't even medication. It's about environment. We turn down the lights, we lower the noise, we swaddle them up snugly to mimic that security they felt in the womb, and we have to be incredibly patient and supportive during feedings, because that can be really, really hard for them.
Your job in this situation is to be this baby's protector. You are literally shielding their overstimulated nervous system from all the noise, the light, and the stress of the outside world. Your calm, gentle, intentional presence is often the best medicine you can possibly give them.
So after all that, what are the big takeaways? Let's boil it all down to the core principles that you can carry with you on every single shift.
I want you to remember these 5 things. First, your assessment is your early warning system. Second, master the basics: warmth, airway, glucose. Third, timing is everything, especially with jaundice. Fourth, wash your hands like their life depends on it, because, well, it does. And finally, never, ever underestimate the therapeutic power of just a calm, quiet environment.
In the end, it really all comes down to this moment. You are that baby's advocate, their protector, and their voice. You have the knowledge and you have the power to turn a really fragile moment into a story of hope and healing. And that is the art and the science of newborn nursing.